He almost ignored what the dog was doing every morning. That would have been his biggest mistake. It started as something Delia thought was sweet. Their golden retriever, Buddy, had always been affectionate, the kind of dog who leaned into you when you sat on the floor, who pressed the side of his face against your leg for no particular reason. So when he began doing the same thing to their son Owen, 2 years old, ginger-haired and generally willing to sit still for exactly as long as it took to reach whatever he wanted, Delia filed it under affection. It was not affection. Or it was something older than that word can hold. Owen would sit on the carpet near the coffee table each morning while Delia made breakfast, and Buddy would cross from his spot by the couch and sit facing the boy, face to face, close enough that their foreheads nearly touched. Then Buddy would angle his nose, not to Owen's mouth, not to his hands, specifically to Owen's left ear, and inhale. Slowly, several times. Then he would pull back, look at Owen, and stay seated. Owen thought it was a game. He leaned into it. Delia watched from the kitchen. She mentioned it to her husband, George, who said it sounded normal. He had grown up with retrievers. They liked faces. Delia agreed because she also wanted to agree. The fourth morning, Buddy did something new. After the ear sniffing, he went to the kitchen doorway and sat there facing Delia, directly, for a full minute. Then he went back to Owen and did the ear sequence again. Then back to the doorway facing her. Delia stopped making breakfast. She put down the spatula. She went to Owen and looked at his ear. It looked normal. She felt the side of his face. Normal temperature. Owen pushed her hand away because he had an agenda involving a toy dump truck. She called the pediatrician's office because she could not explain why she was calling and called anyway. The nurse practitioner, Rhonda Castellano, said, "How long has the dog been doing this?" Delia said, 4 days. Rhonda said, "Can you bring him in this morning?" Owen had a beginning ear infection in his left ear, a bacterial infection at a stage so early that he had shown no external symptoms, no fever, no pulling at his ear, no fussiness beyond his baseline fussiness, which was already a known quantity. The infection had not yet reached the eardrum. The pain that signals most ear infections to parents had not started yet, but the bacterial colony had been producing compounds for days. In a closed space like an ear canal at the concentration Buddy's nose was designed to process, those compounds were as readable as a sign. Dr. Marcus Elwood, the family's pediatrician, explained it to Delia at the appointment. Dogs detect volatile sulfur compounds released by bacterial colonies, the same chemical signature used in some medical diagnostic settings to identify infection. In a small child with an ear canal at a dog's nose height, when both are seated on the floor, the detection works as well as any clinical screening tool at the early stages. He paused. Buddy caught it before symptoms. That means we catch it before the eardrum is affected. He wrote the prescription. Delia stood in the pharmacy with Owen on her hip and texted George, one word, Buddy. If you stay for stories about what animals detect before we do, you're in the right place. Subscribe so you don't miss the next one. Has your dog ever focused on one specific part of your child's body repeatedly, for no reason you could understand? Tell us below. These stories belong here. Owen took the antibiotic for 10 days. The infection cleared without complications. Buddy went back to his normal affectionate behavior. The leaning, the face pressing, the general occupation of any floor space that a person was sitting on. Except every few weeks, he still does the ear check, both ears. Then he looks at Delia. Then he goes back to the couch. She lets him. She is not going to be the person who questions the diagnostic process that works. Every guardian deserves to be recognized, even the ones who never asked for anything in return. If stories like this matter to you, subscribe so you never miss the next one. The next story is about a dog who blocked a nursery doorway for 6 hours straight, and what the parents found when they finally looked inside the wall.